So as was pointed out by Dr. Paulseth, Zamboni said there's at least 5 conditions we need to consider. If there's reflux, and just to tell you, reflux simply means that the blood in the jugulars doesn't just flow toward the heart, but for some reason it stops and goes back towards the brain. That's probably not a very good mechanical thing to be happening because the blood was meant to flow away from the brain toward the heart. There can be reflux in the veins in the brain, similar to those areas I showed you where there was iron content. There has to be evidence of stenosis of the vessel. There has to be the consideration that there may be no flow present. That usually means there's a blockage of the valve, or sometimes there's something called a septum, which is kind of like a flap that sits inside the vein, and sometimes will just block that flow. And then in the final condition was, when he does ultrasound, he has an advantage over MR. He can do me standing up, he can do me sitting down, and when I'm standing up, he's going to find the jugular is collapsed. But that's okay, it's supposed to be when we're standing up. When I lie down, the jugular vein should open up. On those patients who have CCSVI, the jugular vein does not open back up, and sometimes it becomes even worse. So those were his conditions. This is an example courtesy of Dr. Salvatore Sclafani in New York, where he was trying to find a stenosis. And when he first went in looking for this with the catheter and injecting the dye, he didn't find anything. But he was aware of Zamboni's work, so he didn't give up. He kept hunting around until finally when he did this injection, lo and behold, he found that it just stopped. And he caught, in this case, a septum that was not closed originally, and particularly if he puts the catheter up through here, he's going to open that septum. So one has to be very careful in doing these studies. You can have absolutely normal-looking veins, and there's still something wrong. So it's not just simply a bad vein from that point of view. So what I'm showing you here is something very unique to MR, that we can simultaneously take a cut through the neck like this. We call it a transverse section. And that means I can see every vessel in the neck. I can see all the arterial blood flowing up, which is positive or bright in this case, and I can see all the venous blood flowing back down towards the heart. So on the right-hand side here, I show some data from 4 different normal people, and you can see that this data, in this case for the veins, is about 10 centimeters per second, and the flow is always in the same direction. It's always toward the heart. And this is an MS case, and you can see here that for about half of the cardiac cycle, that blood actually either stops flowing or flows backwards. So this is one of those abnormal signs that's indicated by Paolo Zamboni, and this can be seen with extremely good detail in MR. So generally, I would say that there's growing evidence that the more people who are imaged, the more of these abnormalities we're seeing. So I want to stop here and say why the research is so important for this. First, whatever happens in the next few years, even if we find out that everybody should be looked at from an angiology point of view, or to have balloon angioplasty, whatever the final conclusion is, everybody should have an image first, because you want to know what the status of the brain is prior to any treatment. If it's drug treatment, the same thing. Almost everybody who's in a drug trial, I believe, gets an MR scan. So this is really important to know, are you getting better a year later from whatever treatment you had? Is the iron going away? Are the lesions going away? Is the brain recovering? Of course, the best thing is if you're feeling better, but it's also really important to know what's happening. Because if there are 10 different reasons why you have this venous problem, maybe they're not all operable today. Some of these may be so complicated that they might require future developmental technology, such as in the School for Biomedical Engineering, where we might want to develop new grafting materials that will make it easier to treat these veins. Now, I would also like to point out to you that although Zamboni has really the earliest study on this, there was work done in Buffalo by Robert Zavadanoff, who imaged 500 people. And today, more than 1,000 people have been imaged, and about 50% or more of these people with MS show they have some form of venous problem. So there's a lot of work going on here. While we don't have our final approvals yet, in fact, I don't know if anyone in Canada yet has approval, even to do the imaging, I would like you to feel confident that at McMaster, we have continued to investigate in the last 5 months the best way to do the imaging, and I think you've seen some evidence of this. This imaging protocol that we're using today is being used everywhere from Beijing to Jena, Germany to Australia. And this is very important, that people are starting to use the same technology throughout the world so that these data can be compared from site to site. We may end up doing 100 MS cases here, but there are other sites in Canada and around the world who are going to do 50 or 100 as well. What we would really like to do at the end of that time frame is maybe even within a year to have 1,000 cases that we can look at from a research point of view. So the role that McMaster plays and St. Joe's plays, and I do have to say that St. Joe's really came along and picked up the ball here from a clinical point of view, where things had been dropped in a lot of cases, and with the enthusiasm of people like Ian Roger and John Bienenstock and others there, Rick Paulseth, they've really made it possible to proceed in preparing for this study. So there's a great deal of clinical work to be done, a great deal of research to be done, but I think you should realize that many people across Canada, and particularly at St. Joseph's and McMaster, are really taking this seriously. We believe it needs to be done, and we're not going to drop the ball. Thank you.
And good afternoon, everybody. I will try to keep this as brief as I possibly can for you, because I'm sure that you've been storing up some very essential questions, and the reason we're principally here to be with you this afternoon is so that we can help to answer the questions that you might have about both CCSVI and also about the study that we're going to undertake. So I'm going to talk to you, if Pink Floyd will let me, I'm going to talk to you about what we're calling the Hamilton study, which is a combined exercise between McMaster University, St. Joseph's Healthcare, and Hamilton Health Sciences, although the principal site of everything is going to be there, and that's one of the wet pictures of last fall, and this is the area where some of the work will be done in looking at the diagnostic imaging capacity in this brand new innovation tower, which is part of St. Joseph's Healthcare. It'd be nice to show you the spring colors, but I can tell you that these trees have not yet got foliage, so that's why I chose the one that looks a little bit more Canadian. Now, this is Professor Paolo Zamboni, about whom you've heard quite a lot this afternoon, vascular surgeon from Ferrara in Italy. And I had the good fortune to meet with him on the 13th of April, which is just a couple of Tuesdays back. And he's aware of the study. He has, in fact, been through Hamilton. He and his group, and Mark Hakey as well, were there for an afternoon in February where they talked a lot about CCSVI and what is necessary in moving forward to try and examine this hypothesis and see if there's validity to what he is suggesting. And he himself is advocating that there should be some very careful, controlled studies to try and prove what he's saying about blocked blood vessels and MS. And so this is what he said in that conversation with me: studies like yours in Hamilton are essential. And so what I'm going to do for you in the next few minutes is just to give you some brief outline of how we're actually going to undertake this study at St. Joseph's Healthcare. So we're going to do exactly what Professor Zamboni would like to have us do. We're going to rigorously control and critically assess scientifically how we can evaluate CCSVI, or blocked veins, in patients who are both healthy and patients who are suffering from MS.